I am Carol Angela Davis. As the deadly coronavirus continues to spread across the globe, I thought I could give you some comfort by giving you some idea of the fatality rate of coronavirus. Now, Chinese health officials are now revealing new details about the disease's fatality rate. A recent study from the Chinese Center for Disease Control and Prevention, analyzing 72,314 coronavirus cases in mainland China, found that while about 80% of the cases are mild, the virus poses the greatest threat to elderly people who have pre-existing health issues. The research shows patients older than the age of 80 had a 14.9% chance of dying after being infected, while those in their 70s were found to have an 8% chance of death. Patients in their 50s were about 3 times more likely to die than patients in their 40s at a rate of 1.3%. Patients ages 10 to 19 were as likely to die as patients in their 30s. That's just 0.2%. Now, the study did not report any deaths in children younger than 10 years old, who represented less than 1% of all the patients. So your under 10s are good. The study collected data from confirmed patients through February 11th. It's one of the largest such studies of its kind. The risk of dying, you should know, dramatically increases among patients in their 70s and their 80s, as many people in this age group, as you know, are more likely to have pre-existing health conditions. You should also know coronavirus patients with heart disease had a 10% mortality rate, while those with diabetes had a 7% mortality rate. Men were found to have a 2.8% fatality rate versus 1.7% for women. And the study also found that the overall fatality rate in China was 2.3%. Scientists say there are a number of factors that could be contributing to why men are more vulnerable in this current epidemic. Some are biological, they say, because they say women have a stronger immune response to viral infections, particularly of the respiratory tract, and some are rooted in lifestyle, folks, because guess what? The one thing we do know about China is that men smoke in much greater numbers than women, and people smoke more than they smoke in a lot of other countries. You should also know the World Health Organization said people age 60 and older who have a underlying condition like that's right here, I should tell you, that's the World Health Organization saying people age 60 and older who have an underlying condition like cardiovascular disease, a respiratory condition, and diabetes. You should know that the World Health Organization says they have a risk of developing severe COVID-19. That's the coronavirus we're talking about now. And so the World Health Organization is recommending that these people avoid crowded areas or places where they might interact with people who are sick. So stay home for now. You'll be okay. I'm Carol Angela Davis. Thanks for watching.